I had a prednisone warrior ask, what can I take for pain? I just started with the methylprednisolone dose pack. I'm Dr. Megan, your prednisone pharmacist. I'm here to answer that question for you. So, a methylprednisolone dose pack is also called a Medrol dose pack, and it does cause a drug interaction with certain pain medications. So, if possible, you'd want to avoid ibuprofen and naproxen. Those are the over-the-counter versions. There are other NSAIDs, NSAID, little s, that would cause a drug interaction with prednisone. So you would want to avoid those. So what can you take? You can take acetaminophen, which is also known as Tylenol. That is what I would recommend for pain if you have been prescribed a Medrol dose pack. You have a question about prednisone, PMR, and what you can do about joint pain. Hi, doctor. I was on prednisone with PMR for about a year. The PMR is pretty much gone and off the prednisone. Now my gastro doc says I've got symptomatic Crohn's. No symptoms, and it has me on budesonide. I want to stay loose and use ibuprofen to work out, etc. Can you recommend something for me in lieu of aspirin? Thanks. So it sounds like your doctor probably doesn't want you on ibuprofen because you have Crohn's disease and you're taking budesonide, a steroid that's like prednisone, and ibuprofen can be pretty hard on your gut. And so the drug interaction between ibuprofen and budesonide or prednisone can worsen gut issues, cause GI bleeding and stuff like that. I'm inferring that's what you're meaning. And so what would you use in lieu of aspirin or ibuprofen to keep your joints loose? So one thing that I can recommend is called Diclofenac gel. You can rub it if you have hand joint issues. It works really well for hands. It comes in a little tube, and generic name is Diclofenac. It's a non-steroidal anti-inflammatory, a lot like ibuprofen, but you're applying it as a gel directly onto your hands. And so it's not going into your gut. It's going onto the place where the joint issues are. So you can apply it on your hands, your elbows, you could apply it on your knees, your ankles. The only thing is you have to use quite a bit. They give you a little ruler thing where you can squirt it out. And so it depends on how many joints you need to rub it on, is how much you have to squirt out and rub in. And you have to rub it for quite a bit. And you have to use it multiple times a day. It only lasts for like 4 to 6 hours. So it's a great alternative, but it just does come with a lot of rubbing, like on your wrist, your knee. You could even use it on your back, but it's not that good at penetrating that deep into your back or your hips. It's better for the closer joints, closer to your skin. And so, yeah, Diclofenac would work. That is what I recommend. And if you have more questions about this, check out my blog post that goes way more in depth. Signing off is Dr. Megan, your prednisone pharmacist.